Last night, a 72-year-old retired schoolteacher woke up screaming at 2 in the morning. Her husband rushed to her side, terrified, as she clutched her legs in agony. This wasn't the first time. For months, she'd been telling everyone it was just her mattress, just poor sleep quality, just getting older. But what we discovered in her blood work made my hands go cold. And if you're over 60 and experiencing bone pain that wakes you up at night, what I'm about to share could quite literally save your life. I'm Dr. Sophia Reynolds, and I've spent over 15 years as a rheumatologist, working with patients who come to me after months, sometimes years, of nighttime bone pain that everyone dismissed as normal aging or poor sleep habits. What I've learned in that time is that nighttime bone pain is never just about sleep. Your body is trying to tell you something critical, and ignoring these midnight wake-up calls could mean missing early warning signs of conditions that are far easier to treat when caught early. Before we dive in, if you haven't subscribed yet, I highly recommend hitting that subscribe button and turning on notifications so you never miss another health tip made especially for you. If you find this video helpful, please leave your questions and video suggestions in the comments. I read every single one, and it helps me create more content to help people just like you. Now, let me tell you about Margaret. Margaret Thompson, 72 years old, had been a third-grade teacher in Portland for 35 years. She lived with her husband Robert in a cozy 2-bedroom house, and her greatest joy was her weekly visits with her 3 grandchildren. But for 8 months, something had been stealing her sleep and, gradually, her quality of life. Every night, like clockwork, between 1 and 3 in the morning, she'd wake up with a deep, aching pain in her shins and thighs. It felt like her bones themselves were hurting. She bought a new mattress. She tried different pillows. She even started taking melatonin, thinking if she just slept better, the pain would stop. But it only got worse. By the time she came to my office, she was getting maybe 3 hours of sleep a night, and the exhaustion was affecting everything. She'd stopped volunteering at her grandson's school. She'd given up her morning walks. She looked at me with tears in her eyes and said, "Doctor, everyone keeps telling me it's just poor sleep, but I know my body. Something else is wrong." She was absolutely right. What Margaret didn't know, what most people don't realize, is that nighttime bone pain follows your body's natural rhythms for a very specific reason. And understanding this rhythm is the key to understanding what's really happening. You see, certain inflammatory processes in your body actually intensify at night. Your cortisol levels, which naturally suppress inflammation, drop to their lowest point between midnight and 4 in the morning. At the same time, certain inflammatory markers called cytokines reach their peak levels. This combination creates a perfect storm for pain, especially in conditions affecting your bones and joints. So when someone tells you the pain is worse at night because you're lying down wrong or because you're not sleeping well, they're missing the entire picture. The timing of your pain is actually a diagnostic clue. In Margaret's case, her blood work revealed severely low vitamin D levels, measuring just 12 nanograms per milliliter when optimal levels should be between 30 and 50. But it wasn't just vitamin D deficiency. Her calcium levels were also borderline low, and her parathyroid hormone was elevated, meaning her body was literally pulling calcium from her bones to maintain proper levels in her bloodstream. This condition, called secondary hyperparathyroidism triggered by vitamin D deficiency, was causing a process called osteomalacia, where her bones were becoming soft and demineralized. The pain she felt at 2 in the morning wasn't from her mattress or poor sleep. It was her bones crying out as they lost density and structural integrity. And here's what made me realize how serious this had become. Margaret had already suffered a hairline fracture in her left tibia from simply stepping off a curb. She thought it was just a bad bruise. But the X-ray showed the truth. Her bones had become so weak that normal daily activities were now dangerous. If you're still watching and finding this information valuable, please comment "learning" below to show me you're following along. This helps me understand what content matters most to you. But Margaret's story is just one piece of a much larger puzzle. Let me tell you about another patient who taught me that nighttime bone pain can signal something even more urgent. His name was Thomas Chen, 68 years old, a retired postal worker from Sacramento. Thomas had spent 30 years walking mail routes, always active, always healthy. His wife Linda used to joke that he had the energy of a man 20 years younger. But over 3 months, everything changed. He started waking up at 2 or 3 in the morning with severe pain in his lower back and hips. Unlike Margaret, Thomas did everything right from the start. He went to his doctor, got x-rays, even saw a physical therapist. Everyone told him it was degenerative disc disease, a normal part of aging for someone who'd walked thousands of miles delivering mail. They gave him pain medication and sent him home. But Thomas knew something was different about this pain. He described it to me as a deep, boring sensation, like something was gnawing at his bones from the inside. And he was losing weight without trying, 10 pounds in 2 months. When Thomas finally came to see me, after his wife insisted he get a second opinion, I ordered a complete blood panel, including something many doctors don't routinely check: serum protein electrophoresis. What we found changed everything. Thomas had multiple myeloma, a cancer of the plasma cells in bone marrow. This condition causes abnormal proteins to build up in the blood and can lead to bone lesions that cause exactly the kind of deep, nighttime bone pain Thomas was experiencing. The reason the pain was worse at night had to do with how these cancerous cells behave. They release substances that activate osteoclasts, the cells that break down bone tissue, and this process is influenced by your circadian rhythm. At night, when your body should be in repair mode, Thomas's bones were actually being destroyed from within. The weight loss, the specific quality of the pain, the fact that it progressively worsened, these were all red flags that got missed in the initial evaluation. Now, I'm sharing Thomas's story not to frighten you, but to illustrate a critical point. Nighttime bone pain is never just one thing. It's a symptom that demands investigation, and the specific characteristics of your pain tell an important story. Thomas's pain was deep and boring. Margaret's was more of an aching, diffuse discomfort. These differences matter enormously in determining what's actually happening and what needs to be done about it. Let me walk you through what I call the midnight pain profile. When you wake up with bone pain in the middle of the night, your body is giving you specific clues. First, where exactly is the pain? Diffuse pain in multiple areas, like both legs or multiple joints, often suggests systemic issues like vitamin D deficiency, fibromyalgia, or inflammatory conditions. Localized pain in one specific area, especially if it's progressively worsening, raises concerns about structural problems, stress fractures, or in rare cases, tumors or infections. Second, what does the pain feel like? Aching and stiffness that improves with gentle movement often points to inflammatory arthritis or polymyalgia rheumatica. Sharp, stabbing pain that worsens with any movement might indicate fractures or severe osteoarthritis. Deep, boring pain that's constant suggests possible bone lesions or vascular issues. Third, what makes it better or worse? Does getting up and walking around help, or does any movement make it worse? Do heat or cold provide relief? These responses give us crucial information about whether we're dealing with inflammation, structural damage, or circulatory problems. But if you thought those cases were concerning, wait until you hear about what happened with Dorothy Martinez. Dorothy was 80 years old, a retired seamstress from Miami who lived independently in a small apartment near her daughter's family. She'd always been fiercely independent, doing her own shopping, cooking, managing her own medications. But over 6 weeks, her daughter Maria noticed disturbing changes. Dorothy was confused during phone calls, sometimes forgetting they'd just spoken an hour earlier. She'd stopped going to her weekly card games, and she complained constantly about her legs hurting at night. When Maria finally convinced her mother to see a doctor, and when that doctor referred her to me, I discovered something that's far more common than most people realize, especially in older adults living alone. Dorothy had severe vitamin B12 deficiency, Her level was 180 picograms per milliliter when it should have been at least 200, but ideally much higher. This deficiency was causing two major problems. First, it was contributing to peripheral neuropathy, nerve damage in her legs that created burning, aching sensations that were worse at night when she was lying still and paying attention to her body. Second, and this is what really concerned me, the B12 deficiency was affecting her cognitive function, causing the confusion and memory problems her daughter had noticed. You see, B12 is essential for maintaining the myelin sheath that protects your nerves, including the nerves in your brain. Without adequate B12, nerve signals get disrupted, causing both physical pain and neurological symptoms. What made Dorothy's case particularly important was discovering why she was deficient in the first place. She'd been taking a medication for acid reflux for over 5 years, and nobody had told her that these medications can significantly impair B12 absorption. She wasn't deficient because of her diet. She was deficient because of a medication that was supposed to be helping her. After we started Dorothy on B12 injections and worked with her gastroenterologist to find an alternative for her reflux, something beautiful happened. Within 3 weeks, her nighttime leg pain decreased by about 70%. Within 2 months, her daughter called me crying with relief because her mother was sharp as ever again, back to her card games, back to her independent self. Dorothy told me, "Doctor, I thought I was losing my mind. I thought this was just what happened when you got old. Nobody told me a simple vitamin could make such a difference." And that's exactly the problem. Too often, we accept these nighttime symptoms as inevitable parts of aging, when they're actually treatable conditions screaming for attention. Now, I want to talk about something that affects millions of people but rarely gets discussed in the context of nighttime bone pain, and that's restless leg syndrome and its connection to iron deficiency. I had a patient named Robert Williams, 75 years old, a retired mechanic from Denver. Robert's wife had actually kicked him out of their bedroom, not because she was angry, but because his constant leg movements at night were keeping her awake. Robert would wake up multiple times each night with an overwhelming urge to move his legs, accompanied by deep, uncomfortable sensations he described as creepy-crawly feelings in his bones. He'd get up, pace around, and only then would he get temporary relief. His primary doctor had diagnosed restless leg syndrome and prescribed medication, but it barely helped. When I evaluated Robert, I checked his ferritin levels, a measure of iron stores in the body. His ferritin was 32 nanograms per milliliter. Now, technically, that's within the normal range that most labs use, but here's what most doctors don't know. For neurological function and for preventing restless leg syndrome, ferritin levels really need to be above 75, ideally closer to 100. Even though Robert wasn't anemic, his iron stores were too low to support optimal dopamine function in the basal ganglia, the part of the brain that controls movement. This creates the restless sensations and the irresistible urge to move. We started Robert on iron supplementation, carefully monitored to avoid side effects, and within 6 weeks, his symptoms improved dramatically. Within 3 months, he was back in bed with his wife, sleeping through the night for the first time in 2 years. He told me with a huge grin, "Doc, my wife says I can stay. Best news I've had all year." The reason I'm telling you about these different cases is because I want you to understand something crucial. When you wake up at 2 in the morning with bone pain, you're not being dramatic. You're not just dealing with a bad mattress or poor sleep hygiene. Your body is sending you a signal, and that signal deserves to be heard and properly investigated. The question isn't whether nighttime bone pain matters. The question is what's causing it and what we need to do about it. Let me share one more case that really drives this home. Patricia Anderson, 69 years old, was a retired librarian from Boston. She'd always been health conscious, exercised regularly, ate well, took her vitamins. But for 4 months, she'd been waking up between 2 and 4 in the morning with terrible pain in her hips and shoulders. The pain was so severe that she couldn't lift her arms above her head in the morning, and getting out of bed felt like her joints were frozen. She'd seen 3 different doctors, One said it was osteoarthritis, another said it was tendinitis. A third suggested it was just normal aging and prescribed anti-inflammatory medication. But the medication barely touched the pain, and Patricia was getting desperate. She'd stopped playing with her grandchildren because she couldn't pick them up anymore. She'd quit her book club because she couldn't sit through a 2-hour meeting without being in agony. When Patricia came to my office, something in her story caught my attention. The pain was bilateral, meaning both sides of her body equally. It was worse in the morning but had actually started at night. And most importantly, she mentioned feeling unusually fatigued, like she could barely get through the day even though she was getting adequate sleep. I ordered a blood test for something called erythrocyte sedimentation rate and C-reactive protein, both markers of inflammation. Her ESR was 78, when it should be under 20. Her CRP was 42, when it should be under 10. These dramatically elevated inflammation markers, combined with her symptoms, pointed to a condition called polymyalgia rheumatica. This is an inflammatory condition that almost exclusively affects people over 60, and it causes exactly what Patricia was experiencing: severe pain and stiffness in the shoulders, hips, and neck, worse at night and in the morning, caused by inflammation in the lining of joints and around tendons. Here's what's remarkable about polymyalgia rheumatica. It's one of the few conditions in medicine where treatment provides almost immediate dramatic relief. I started Patricia on a moderate dose of prednisone, a corticosteroid that reduces inflammation, and I will never forget the phone call I received from her 3 days later. She was crying, but they were tears of joy. She said, "Dr. Reynolds, I woke up this morning and got out of bed without pain for the first time in months. I thought I'd lost my life, and you gave it back to me." Within a week, she was back to playing with her grandchildren. Within 2 weeks, she was back at her book club. The transformation was nothing short of miraculous, and all because we correctly identified what her nighttime bone pain was really telling us. Now, I know what you might be thinking. You're wondering, "Dr. Reynolds, how do I know which of these conditions might be affecting me? How do I know if my nighttime bone pain is something serious or something more benign?" That's an excellent question, and I want to give you some guidance on what should prompt immediate medical attention versus what can be monitored. You should seek medical evaluation right away if your nighttime bone pain is accompanied by unexplained weight loss, fever, or night sweats. These are red flags for possible infection, malignancy, or severe inflammatory conditions. If the pain is localized to one specific area and progressively worsening, especially if it's associated with a history of cancer. If you're experiencing new neurological symptoms like numbness, tingling, weakness, or changes in bowel or bladder control. If you have sudden onset of severe pain after minor trauma, which could indicate a fracture in weakened bones. If you're experiencing confusion, memory problems, or other cognitive changes along with the pain. Even if you don't have these urgent warning signs, you should still discuss nighttime bone pain with your doctor if it's been persistent for more than a few weeks, if it's significantly affecting your sleep quality and daily function, if over-the-counter pain relievers aren't providing adequate relief, or if you have risk factors like vitamin D deficiency, history of osteoporosis, or chronic use of medications that affect bone health. The evaluation process should be thorough. A good physician will take a detailed history about the pain's characteristics, timing, location, and associated symptoms. They should perform a physical examination assessing your joints, muscles, and neurological function. Blood work should include a complete blood count, comprehensive metabolic panel, vitamin D levels, calcium, and inflammatory markers at minimum. Depending on your specific symptoms, additional tests might include vitamin B12, ferritin, parathyroid hormone, or specific antibodies for autoimmune conditions. Imaging studies like X-rays, bone density scans, or MRI might be necessary to evaluate bone structure and rule out fractures or lesions. Here's what I want you to understand on a deeper level. Your bones are living tissue. They're constantly being broken down and rebuilt in a process called remodeling. This process is influenced by your hormones, your nutrition, your medications, your activity level, and your overall health. When something disrupts this delicate balance, your bones suffer, and pain is often the first signal you receive. The reason this pain is worse at night isn't random or meaningless. It's tied to your body's circadian rhythms, your hormone levels, your inflammatory processes, and your nervous system's heightened sensitivity when external distractions are removed. Think about it this way. During the day, you're busy. You're distracted by activities, conversations, visual stimuli. Your brain is processing countless inputs, and pain signals can get partially filtered out or overlooked. But at night, in the quiet darkness, lying still in bed, your brain's attention turns inward. Pain signals that were always there become impossible to ignore. Additionally, as I mentioned earlier, your anti-inflammatory cortisol levels drop at night, allowing inflammatory processes to intensify. For someone with vitamin D deficiency, the process of calcium being pulled from your bones continues, but without cortisol to moderate the inflammatory response, the pain becomes more pronounced. For someone with polymyalgia rheumatica, the inflammatory cytokines that cause joint stiffness reach their peak in the early morning hours. For someone with restless leg syndrome related to iron deficiency, the dopamine dysfunction that drives the discomfort worsens when you're trying to rest. Understanding these mechanisms isn't just academic, it's empowering. When you know why your bones hurt at 2 in the morning, when you understand the biological processes at work, you can work with your doctor to address the root cause rather than just masking symptoms. Margaret didn't need a new mattress. She needed vitamin D supplementation and dietary changes. Thomas didn't need more physical therapy. He needed prompt treatment for multiple myeloma. Dorothy didn't need to accept cognitive decline. She needed B12 replacement. Robert didn't need stronger medication for restless legs. He needed iron supplementation. Patricia didn't need to give up her active lifestyle. She needed treatment for polymyalgia rheumatica. Each of these people had been suffering unnecessarily because their nighttime bone pain was dismissed, misdiagnosed, or inadequately investigated. And I meet new patients like them every single week. The tragedy isn't that these conditions exist. The tragedy is that they're often missed or ignored until they've significantly impacted someone's quality of life, or, in some cases, until they've progressed to a point where treatment is more difficult. So, what do you do now? First, start keeping a pain diary. Document when your pain occurs, what it feels like, what makes it better or worse, and any other symptoms you're experiencing. This information is invaluable for your healthcare provider. Second, schedule a comprehensive evaluation with your doctor. Don't be satisfied with vague reassurances that it's just aging or poor sleep. Advocate for thorough blood work and appropriate testing. Third, review your medications with your doctor. Many common medications can affect bone health, vitamin absorption, or contribute to nighttime discomfort. Fourth, optimize your nutrition. Ensure you're getting adequate vitamin D, calcium, vitamin B12, and iron through diet or supplementation as appropriate for your individual needs. Fifth, maintain regular physical activity appropriate for your condition. Movement, done correctly, supports bone health and can help reduce pain. But most importantly, trust yourself. If you know something isn't right with your body, if you feel that your nighttime bone pain is more than just a minor inconvenience, speak up. Be persistent. Seek second opinions if necessary. You know your body better than anyone else, and your symptoms deserve to be taken seriously. I want to leave you with this thought. Your body is incredibly intelligent. Every symptom, every sensation, every pain signal is your body's way of communicating with you. Nighttime bone pain isn't your body betraying you or failing you. It's your body trying to protect you by alerting you to something that needs attention. The worst thing you can do is ignore these signals or accept them as inevitable. The best thing you can do is listen, investigate, and work with knowledgeable healthcare providers to identify and address the underlying cause. Margaret is now sleeping through the night. Her vitamin D levels are optimal, and her bone density has improved. Thomas caught his multiple myeloma early enough for effective treatment and is doing remarkably well. Dorothy is back to her independent, sharp-minded self. Robert is sleeping peacefully next to his wife. Patricia is playing with her grandchildren again. These aren't medical miracles. They're the natural result of properly identifying and treating the real causes of nighttime bone pain. If you're experiencing bone pain that wakes you at night, please don't wait. Please don't dismiss it. And please don't let anyone tell you it's just poor sleep or just aging. Your bones are trying to tell you something important. Listen to them, investigate, and take action. Your future self will thank you. If this video has been helpful, please share it with someone who might be experiencing similar symptoms. Leave your questions in the comments below, and remember to subscribe for more health information designed specifically for you. And most importantly, talk to your doctor. Show them this video if it helps start the conversation. Your health and your quality of life are worth fighting for. Never forget that.